morning's webinar. Mutual Ventures, for those who haven't come across us, we're advisors in public service improvement and innovation, and in children's services sector over the last decade, we've supported delivery of national programs such as the Children's Social Care Innovation Programme, regional adoption agencies, and the Strengthening Families Protecting Children programme. We're particularly interested in the part that advanced analytics can play in informing user-led service redesign, and I expect many of you here today will be too, hence the webinar. This is the second in a series of webinars that we're hosting throughout September and October on a range of important topics for the public sector. Today, with colleagues from the Early Intervention Foundation, Barking and Dagenham and Xantura, we'll explore how data can empower social workers to make better decisions, identify at-risk cohorts, and improve resource planning by better predicting demand. Our focus on children's social care today, there'll be a further webinar on Friday hosted by colleagues at the Social Care Institute of Excellence to explore the same theme, but with a focus on adult social care. Of course, in preparing this webinar for today, we've been very conscious that we're running hot on the heels of the aborted attempt to use advanced analytics to grade A-level and other national examinations. Not the best press for analytics. Fortunately, from conversations we've been having with sector leaders, it's quite clear that people can generally see beyond that particular debacle to the important role that intelligently and appropriately applied data analytics can have in helping the sector to tackle multi-pronged issues really of reduced funding, increased demand, increased case complexity, and the ongoing workforce issues across the sector. With children now having returned to school after 5 months of COVID-19 lockdown, the sector is bracing itself for a potential spike in referrals. As the current ADCS President Jenny Cole stated in her address to the sector, we anticipate that the hidden harms to the children over the past 6 months will be uncovered. During this period, we expect to see an exponential surge in demand for children's services when we anticipate the need to support more families and the severity of need to increase. Matt Dunkley, Corporate Director for Children and Young People at Kent County Council, says there could be a 250% rise in referrals of children that need to be investigated as lockdown is eased. This will create real and significant funding pressures both this year and next. It's been quite interesting to read in recent days in the Municipal Journal how Hackney have been able to redirect their analytics capability to the task of identifying those in their communities who may be in most need of support. There's certainly an opportunity to use data analytics to help professionals rise to the challenges ahead. A note of caution though, even before the events surrounding this summer's examination results, challenging questions have been raised with regard to the ethics of using algorithms and advanced analytics to predict social care risk. You may have seen the report from the What Works Centre for Children's Social Care undertaken by Turing Centre and Rees Centre. This was published in January this year. That report offers some helpful and balanced thoughts on the pros and cons of advanced analytics and its application to children's social care. In particular, it emphasises the importance of robust information governance when applying these approaches. Now, we don't intend to get into that in huge detail today, but I hope some of you with concerns about this will be encouraged by the rigour that Xantura take with their particular approach. We'll hear more on that from Wajid Shafiq of Xantura later. Throughout this session, I'd encourage you all to hold on to the point that data analytics is not an end in itself. It's a technique, a set of tools to support better decision-making by professionals. It's not a replacement for that. On that important note then, let me introduce today's speakers. First of all, we have some opening thoughts on the part that data has to play in early intervention from Tom McBride of the Early Intervention Foundation. Sadly, Tom was unable to be here in person, but we have his contribution in absentia. Tom is Director of Evidence at the Early Intervention Foundation, which is a member of the government's What Works network. They were established in 2013 to champion and support the use of effective early intervention to improve the lives of children and young people at risk of experiencing poor outcomes. Tom leads evidence generation across the organisation. He's a research and analyst specialist, has held leadership roles at both the DFE and NAO in that field. We then have a trio of speakers for our main feature. PA Nyunt, Head of Insight and Innovation, Policy and Participation at London Borough of Barking and Dagenham. We have Wajid Shafiq, founder and CEO at Xantura. Wajid has been implementing cutting-edge software solutions since 1988, but it was a serious case reviews of the early 2000s that inspired him to apply those skills to help the vulnerable, leading him ultimately to found Xantura in 2008. And Wajid is accompanied by Celia, director at Xantura. Hannah's a clinical criminologist with more than 20 years experience of designing, developing and managing services for society's most vulnerable people. Together, PA, Hannah and Wajid will tell the story of how Barking and Dagenham are harnessing the power of data to predict demand, understand risk and target resources to achieve the best possible outcomes for children and their families. They'll show how this gives social workers information to make informed decisions and support their professional judgment. Following their presentations, we hope to have 15 to 20 minutes for questions and a few domestics just to help us get into that. You'll see that Zoom chat is turned off, but please do submit questions through Zoom's Q&A function as and when they occur to you, and we'll look to answer as many of those as we can in the Q&A session. For Twitter fans among you, please use hashtag #CSData, which you'll see on the slides, if you want to post comments or thoughts throughout the seminar. Do please only post questions on the Q&A function via Zoom though. So without further ado, on to our main presentations. We'll have some brief opening thoughts from Tom McBride, and then we'll pass straight on to colleagues from Barking and Dagenham and Xantura.
Hello, my name's Tom McBride and I'm the Director of Evidence at the Early Intervention Foundation. We're a government work centre dedicated to ensuring that effective early intervention is used to improve the lives of children and young people at risk of poor outcomes. What this means is that we try to ensure the best available evidence is used to design national policy and local services for children and families. I'm very sorry that I can't be at this event, but I wanted to offer a few thoughts in advance to hopefully frame the discussion. Firstly, around what early intervention is and the role of data has in that. For us, early intervention means providing evidence-based services to those children and young people at risk of poor outcomes. Making the best use of the available data is crucial to this in several ways. Firstly, around identification. Rather than waiting for a crisis or the point at which families require statutory services, using local data to identify the families who may be most in need of support and using real-time data to understand if families are becoming more vulnerable is a crucial element of getting services to children and young people as early as possible. Secondly, around service provision. Early intervention will only work if the services provided meet the specific needs of an individual. Data can never be used to replace the assessment of a skilled practitioner, but it can provide useful insight into the complex set of factors a family is facing, which can help ensure that the right support is provided at the right time. And finally, in terms of monitoring and evaluation, it is essential that we understand if the services are delivering as expected to children and young people. Of course, this will often require us to gather data directly from service users, but we should also think about how routine admin data such as school attendance, rent arrears and social service status can also be used to tell us if an intervention is improving outcomes for children and young people. I also wanted to offer a few thoughts on COVID and the impact that it will have on children's services. We need to think about how the pandemic will impact on social services and how we can intelligently use data to support families as we emerge from the lockdown. We don't fully understand the impact that this pandemic has had, but we expect it to increase pressure on families with unemployment rising, mental health deteriorating, and issues like domestic abuse and child neglect rising. Using data to identify the families in need of support, many of whom may not have been well known to services prior to the pandemic, has to be part of ensuring that COVID doesn't leave a lasting scar on the children and young people's life chances. I hope this provides some useful insight for your discussion today, and you have a successful seminar in exploring the power of data to really transform services and help support the most vulnerable in our society. Thank you.
Thanks for those opening remarks, Tom. And I'd now like to hand on to PA, who is going to lead our presentation from Barking Dagenham.
Thanks very much. Could I just double check that you can hear me okay?
That's all good, PA.
Great, thank you. My apologies, I'm unable to switch the video on because I'm having to run this from my mobile, but hopefully you can all hear me loud and clear. Good morning, everyone. Thank you ever so much for joining. My name is Pierre. I'm the Head of Insight and Innovation at the London Borough of Barking Dagenham, an East London local authority. And I lead a team of data scientists, behavioral scientists, and service designers. And our mission is to turn data into insight-led action. We've been around in the council working internally for about 4 years now, and actually it's great to hear both David and Tom talking about the importance of early intervention and specifically how data analytics, when used ethically and proportionately, can play an important role, and that is very much my job in the local authority. So at B&D, early intervention and prevention is one of the key principles of our council strategy, as you can see on this slide here. So I wanted to sort of give you a brief sort of scene setting for the work that we've been able to deliver in children's, but also in other parts of the organisation. So for us in B&D, in order to make predictive analytics work really well, there's important things around culture, strategy, and approach. And my next 3 slides sort of detail a little bit about what that means for us. So following the creation of our various service blocks in 2015, we spent several years kind of developing a strategy to deliver on our No One Left Behind philosophy. And that comes with increased partnership working and cultural and transformational change. So when we started to explore the One View solution with Xantura, we realized that it kind of fit hand in glove with the work that we were already doing, and their technology platform really enabled us to overcome some of the our barriers and accelerate our ambitions. Could I go to the next slide, please? Wonderful. So this is a slide that our chief exec quite often likes to show, and the importance here is really the balance between finding the science behind analytics and also the human intimacy and relationships that we want to build with our residents, and this is something about our approach, and for me always a test of are we making sure that those two things are balanced and we find them hand in hand. Next slide, please. So this is just 3 very simple steps on how we've been engaging the service. So importantly, co-creation with the domain experts is absolutely key to making these things work well. As I mentioned, I've been in the council leading this team for about 4 years now, but none of us are the true domain experts. We're experts in analytics and behavioral nudges and so on and so forth, but we're not the experts in social care. So the important thing was to engage frequently and early with those particular parts of the organization, and then secondly, to create use cases based on their own existing methodologies and processes, as opposed to just trying to start something completely different. So what is key about that is it helps frontline staff engage with the insight better when they are more familiar with it supporting its own processes, but also unveils a level of change management that is required when we think of new and innovative things. Great, next slide, please. Okay, so how do we use OneView in children's? You know, as the speakers before that have all said, technology needs to be implemented in a way that supports professional judgment. You know, just kind of short words really on the platform itself. So OneView enables us to take data from across all people based council services and wider partners to create a single holistic view of residents and households. So the platform is unique in that the information governance approach is embedded within it, which means that we as the authority have complete control over how every piece of data is used and shared, and it's embedded in the platform entirely, making it completely auditable. So we know exactly who's accessed what. Important to also note here that just at the bottom there that in the early stages, as much as engaging with domain experts, but we also engage with the ICO, and they have provided us with feedback and indicated that much of what we're doing, well, sorry, all of what we're doing is compliant with data protection. So we started working in children's services, but have now expanded into housing and adults, and as well as looking at COVID and the single view of debt. So we've got several modules underway already in OneView, but wanted to explain a little bit here about our use of OneView in children's social care. So what we did in CSC is firstly embed case summaries into the case management system. So this means that our social workers have the ability to click on a single button on any case and that they're working on, and they're presented with a case summary which provides an overview of all the council and partner information about that household in a text format. Hannah's going to show you that as a quick demo in a minute. Just to sort of to mention here as well that the platform also generates proactive alerts, which identifies families with escalating risk, and these cases are then surfaced to teams to undertake outbound contacts where appropriate. And finally, the management team have access to several customized dashboards, which enable us to have an up-to-date picture of current caseload, future predicted demand levels, the range of risks inherent in our cases, and a summary of which cases may be in the wrong tier of support. So collectively, these provide our social workers and our management teams with additional tools and support to help them to do their jobs more effectively. Next slide, please. That's over to Hannah.
It is, thanks, PA. I'm going to walk you through a case which has been anonymised. I'll then show you how the case looks in Liquid Logic using OneView. We've changed names of the case to protect them, but the details of the case remain the same. This case is initially about a mother and a daughter. Mother had some significant issues around substance misuse and domestic violence, and her daughter was subject to child in need and then child protection. Unfortunately, when the daughter was young, her mum died of an overdose. She was able to go and live with her grandparents and settle into a new life. She was stepped down to support from early help, which closed in 2017. Over the next period of time, the census data showed some escalating risk around attendance and exclusion for behavioural concerns. Unfortunately, last December, her grandfather died. This information was captured in the Revs and Bens data, and shortly afterwards there was an increase in debt with some rent arrears, and grandmother got behind on her council tax. Grandmother was afraid to ask for help for fear of having her granddaughter taken away from her. In January 2020, OneView picked up the increased risk factors and an alert was raised into the children's mailbox for attention. OneView summarised the presenting issues and needs of the household and where they came from for triage. Following this alert, the family re-engaged with early help and were referred to the housing advice team as part of a partnership plan. They got immediate help with finances, a referral to the community supermarket and food bank, whilst waiting for additional benefits that grandmother did not know that she was entitled to. In April, risks regarding COVID-19, such as respiratory condition and being over 70, were identified through OneView. The worker was able to offer support during lockdown, collecting prescriptions and doing some shopping. At present, there is a repayment plan in place for council tax debt and a reduction in rent arrears. The worker helped prepare for return to school last week. One of the most important outcomes has been the positive relationship with all council departments and the reduction in fear in asking for help. It's clear that without the joined up view of risk from all of the systems in the council, there could have been a very different outcome for this family, a potential looked after child or homeless family, poor educational outcomes and unmanageable debt, to name a few. I'm now going to play the recording of what the case looks like in liquid logic at the moment with OneView. Please note that I talk for a bit over the blurred out liquid logic screen where the button sits, and the video looks like it's not working because it doesn't move. Don't worry, it's not broken. And we have replaced all identifiable details such as names in the summary of this video, but the detail of the case remains the same. I'm going to have a look at this case, which I know is a little girl who has had a fairly horrendous past, with her mother dying through a drugs overdose. She went to live with her grandparents, and then her grandfather died last December, which made the household unstable. Grandmother was struggling, but didn't want to ask for help because of fear of losing her granddaughter. Following identification through OneView, they are now receiving some financial support, early help support, and some bereavement counselling from an external agency. I'm going to click the OneView button to get some more information. The system identifies who I am and my role as a manager reviewing the case. I will be able to see the whole case, but if I click different roles, I will only see the level of detail relevant to that role. We have single sign-on, which means that it works with my existing liquid logic credentials. I can see Emily and her grandmother and grandfather who has died, and I can see all the system references, which is useful for talking to partners. I can see the family are open to early help and bereavement support. Good, I can see the workers' details. That will be helpful to speak to the person who knows Emily and is working with her. I can see there have been some financial pressures and work has been done by housing support. This all came about from discovering the family were in crisis following the death of Grandad and the changes that that made to their financial situation. Looking at the risks in more detail, they have obviously been impacted by COVID with risk factors of disability and financial issues and grandmother having respiratory conditions. There are obviously concerns with grandma being over 70 as well. Over the past year, there looks like there's been a lot going on. School issues, emotional well-being and trauma from the previous issues with Emily's parents, which must have been compounded by the death of her grandfather. The school issues are improving, but I guess this is due to not being recorded during COVID. I'll keep an eye on that. Early help will be putting in place support for the first weeks back at school. They are engaging well with support and have positive relationships and are well presented and clean. Ongoing grey areas are historic trauma and home environment, maybe the housing situation. There is obviously an issue with council tax debt that is getting worse at the moment. A bit of background. Previously DV recorded, but not recently, and it looks like it was witnessed by Emily. The family are well known to Children's Services previously from the death of Emily's mother and the transfer of her care to grandparents. Lots of contacts raised by all agencies in the past, so lots of visible distress that professionals have noticed. Looking at the chronology, this is really helpful, seeing all the partnership information instead of just the children's services history in one place. Great for a quick view of the past 10 years and for pulling out the relevant things that have happened. Risk factors appearing most months from various case notes. Even though the case is open to early help and housing support, there seem to have been lots of issues. The detail goes right back to 2010, so 14 years of issues that have needed support and a long-term drain on our resources. I wonder if we can put a better long-term support package in place to get sustained change for this family.
Thanks, Hannah. And hopefully everyone can see from this example, albeit the case, whilst blurred out, is very real, and we've shown some kind of dummy example there for illustrative purposes. The power of understanding that information, particularly over the long term, and also that within one view gives us both in terms of being alerted to early cases that might need supporting and providing an instant thorough case summary, which also enables social workers to spend less time on the administrative burden that comes with attempting to find the whole history of the case. So we're going to show another video which provides an overview of one of the operational dashboards that we're currently using. This is one for our early help cases. I think there was a question about being able to see this in a bit more detail, so hopefully you'll be able to see this in the video. So the video shows how the Children's Services team are currently using the dashboard to support a number of different activities, which I want to briefly walk you through. We can use the dashboard to see the future expected demand in each tier of service, and where these cases are coming from to enable us to better manage our resources. They also provide an understanding of how our current caseloads are distributed amongst the team, both in terms of volume, severity, and geography, to enable us to better support those resources. We have the ability to build specific cohorts of children and families with different risk characteristics, which enables us to provide proactive support where appropriate. And this has been particularly beneficial during the COVID outbreak. Also, contextual safeguarding uses the model the model built to see risk from outside influences and demographic factors, and view risk of serious harm, exploitation, or gang-related violence. For any of you on the call who might have previously been following kind of the analytics work at Barking and Dagenham, several years ago we developed something called our Social Progress Index, which is essentially almost like a model of unmet demand. And working with Xantura, we're now kind of repurposing that Social Progress Index to fulfill more of that contextual safeguarding purpose. And we can also monitor the impact that our interventions have on a range of different risk factors to understand their efficacy and their impact on wider risk factors in households. And finally, we can see a view of how long cases have been in the team and whether or not these cases should be reviewed with respect to stepping up or stepping down the cases based on the changing risk factors. So another quick overview of the early help dashboards in the video next.
We have approximately 2,500 active early help cases at the moment, which is 16% less than usual. Over the past 3 months, there have been less step downs from SIN than there would have been usually, and I can expect a massive increase in demand that will appear in early help in the next period now that schools are back. I need to look at capacity, my workers' caseloads, and the level of risk that they are holding. We have set up sub-cohorts that we can view separately, those for proactive contact and those with risk factors relating to the sanctions of COVID-19. We will need to continue to monitor these risks separately. Looking across our cases, it looks like by far the most cases are coming straight into early help from universal services, and only some are stepping down from SIN and CP. We have a meeting next week to look at this, and I'll use the dashboard to drill into the cases that should be stepped down and encourage the workers to do so. We will also look at the cases that are escalating in early help and check demand and capacity at every level. I can see all the usual risks that I would expect from early help cases. We've noticed over time they are becoming more complex and wider sets of issues are occurring. The debt picture is varied, some coping, some struggling and some in crisis, and now we can see them all in one place. We have a contextual risk model as part of these dashboards, which looks at a set of risk factors specifically related to gang and serious violence, exploitation and contextual safeguarding. The risk factors are mapped to the level of support that would be most appropriate to prevent escalation of concern and prevent them ending up in serious harm, from universal services through to specialist support. This means we can look at both traditional safeguarding and contextual safeguarding support levels at the same time and see when someone is moving towards risky outcomes. In the transition risk chart, I can see how the level of risk maps to our thresholds and which cases are at about the right level, which are escalating and at risk of stepping up, and which are reducing in risk and may be able to be stepped down. I can also see how long the cases have been open, which will help me make sure families are not stuck or becoming dependent on support workers. The chart on the right helps me see the impact of our interventions on each of the risk factors. I can see that early help is having a really positive impact on child exploitation and financial exclusion, but more support may be needed for cases with health issues.
Thanks, Hannah. So as the Hannah's earlier presentation outlines, OneView does identify cases that are at risk earlier, and I think it's pertinent to mention here that those risks come from the way that domain experts have identified those thresholds, and it's also important to mention that the challenge here for us remains on how we transform the way we work as services to respond to this wealth of information. Fortunately for Barking Dagenham, that is the purpose of our frontline services and our kind of early help offer, led by the Community Solutions service block, and very much the work that my team does to help OneView deliver impactful change. And whilst with any tech and change solution doesn't come without challenges, I think the feedback from several of our stakeholders has been very positive, as you can see from some of the quotes on this slide, and both the case summaries and the alerts and dashboards have made a significant impact to the way that we review cases within the team and engage with wider council services. And again, pertinent here to say that this is an iterative process that we've been working closely with services, the Xantura team and my team to deliver on. So it is not always going to be perfect first time round, but what's important is to have open and honest conversations with all of the stakeholders and try to iterate as much as you can until we get to the most accurate solution as possible. Speaking of working in partnership, this slide, we've been working with Xantura now for about 18 months. OneView perhaps hasn't been live for that amount of time, but when I say working with it, very much kind of early stages of design and thinking around what was going to work best for B&D. So we very much consider this to be a partnership. And I think just to use one particular stat, this this way of working has reflected in how quickly we stood up our COVID-19 intelligence module. Took about 3 weeks to pull together, and we a favorite statistic of mine that I like to say quite often is that we identified well over 90% of the shielding list without actually having it confirmed from the government. And for those of you who may recall, there were several and various delays on getting the shielding list out and various iterations of it. And for us in B&D, that was about in total about 8,300 people who received on the shielding list. So we, via OneView, we were able to identify over 90% of them weeks before the confirmed list came through, and we've delivered a huge amount in that time, and now have sort of the COVID system operational across a range of different services, but totally acknowledging that we still have a lot of work to do in terms of tuning the outputs, improving data stewardship, and most importantly delivering to our business change required in community solutions. So, and these will no doubt evolve. Our short-term focus is in a couple of these areas. So continuing to iterate the outputs from the platform in partnership with our teams, starting to explore the pathways between different agencies to build on our promises of no one left behind and no wrong door. By understanding the holistic view, we can see which agencies are best placed to lead on cases and avoid duplication for the council. And frustration for our families. As our models become more mature, we can also start to see the efficacy of the interventions we're using with different cohorts and build a real understanding of what works to inform future policy and commissioning. And the ability to identify cases earlier has huge long-term benefits, but brings with it a short-term squeeze on capacity. So we're starting to explore how we can ease this capacity by using technology to signpost individuals and households earlier and encourage them to answer the council for further support. And the one last thing to mention before I hand over to Wajid is I think that the framing at the very beginning of this webinar was about ethics and transparency, and all very important things. And at B&D we have struck another partnership with the Lovelace Institute. They are a national body essentially kind of examining ethical practices in the use of advanced analytics and emerging technologies. And so they've actually been sort of independently documenting this particular journey, and their report will be available to all. And hopefully that's a good segue into Wajid is going to talk a little bit about information governance.
Thanks very much, PA. Next slide, please. Well, thank you, PA. So hopefully, I think what we've done is we've provided a reasonable overview of what an implementation of OneView delivers and feels like for a client. I'd like to just spend a little bit of time talking about how we address very valid concerns around ethics, algorithms, and ultimately how that materializes in terms of information governance. As you would have seen in the first video, the system implements data sharing protocols, DSPs, to control access to data. And you saw that in the first video when the user was prompted to say why they were about to look at a case, they had to select a role. What I'd like to run through is how we arrive at these DSPs from an ethical perspective, secondly, from the perspective of how we safely deploy algorithms in that context, and then thirdly, as I said, how that materializes in terms of information governance. So initially looking at ethics, I guess the first observation here is that ethics is a human consideration. So algorithms and maths are completely oblivious to ethics. So for example, they're being used by payday loan companies to target loans of vulnerable people,
but also, on the other hand, they're being used by hospitals to improve cancer detection rates. So our ethical approach and principles are framed in that context in children's services through the support tiers that already exist. And as children move through these tiers, our approach is that they experience increasing numbers of adverse and harmful experiences. So if we prevent a child moving to the right or help them move to the left, then essentially what we've done is prevented harmful experiences. And in that context, what we've done from a OneView point of view is built 2 predictive models for each one of those tiers. So a predictive model that predicts the likelihood of children that are likely to step up to the next tier, so we can try to prevent that happening. And also models at each tier which predict the likelihood that a child or family is could be stepped down. And therefore we can basically bring them down in terms of the interventions that are going in. In summary, and that's a very high level, but in summary, by using those children's services support tiers to frame the work, we've created an ethical framework that is about reducing harm. So next slide, please. So let's move on here. So I guess, so having established kind of an ethical framework, what I'd like to briefly consider is those step up and step down algorithms that I've just outlined. Specifically, what is different about them. So first of all, algorithms aren't new. There's 2 examples here that are on the slide. The first one helps youth offending teams to understand reoffending risk, the likelihood that people are going to reoffend, and DASH, which is also obviously about kind of predicting domestic violence escalation risk. Both of those models have been developed based on research using historic cases and on professional input. And the results are models that use both static and dynamic risk factors to, for example, in the youth, to predict forward. And for example, in the youth justice model, it looks at familial context in terms of issues at a family level, as well as the offences that have occurred, to kind of build a prediction in terms of what the likelihood of reoffending is. The resulting algorithms are typically some form of spreadsheet or a table that gets filled in. So what I'd like to do just before kind of moving on really is just for a minute just to pose a few rhetorical questions at that point about those specific algorithms. So in looking at DASH specifically, what do we think, has DASH reduced the role of professionals? Do they drive automated interventions? So does a police officer turn up at an incident, do a DASH score and automatically arrest somebody on the basis of the DASH score? Have they been assessed for bias? Do police officers give higher DASH scores to specific ethnic groups or economic groups? So the key point I'm trying to make there is it's not this, the use of algorithms isn't new and the ethical problem isn't new. The devil really is in the detail of the implementation. And that's kind of the key thing kind of that moves on kind of in terms of information governance and how we implement the systems in a way that they are implemented in a way that's appropriate. So the key point is that, and I guess this has been made several times by several speakers, if implemented effectively, there should be decision support tools that support the work of professionals. So just moving on to the next slide. So building on what I've just outlined, effective information governance for us is actually, it's the most important thing. It's the key enabler that brings all of this together and enables the development of systems that are about preventing harm and not just responding to crises. And I guess the observation that we make is, unfortunately, quite often information governance results in systems that are only about are only sharing data after crises. Our view is that it shouldn't just be about producing paper documents, data, DPIAs, data sharing agreements, but it should be embedded into the heart of the way the systems work. And you saw that materialize when Hannah was doing her demo and she selected a DSP, but what sits behind that? So if implemented well, first and foremost, it should make sure that all data is compliant with standard data, basic stuff, data protection and wider legislation. Secondly, it should actively enable the prevention of harm, as I mentioned, by sharing of data before crises happen. And finally, it should over time build trust. And that's a really important point in the way that we implement systems is that over time, as people can see that this is a controlled, auditable process, that people feel comfortable adding data to the system and we're using it in a way that's appropriate and proportionate. So just before I talk about the graphic here, I'd just like to reiterate the point that PA made, which is that the underlying detailed design of this in general, but also specifically in children's services, has been reviewed by the ICO. And the feedback that we had, I think it was last month, wasn't it, PA, that the approach was compliant with data protection legislation. And so we were doing something that was appropriate and proportionate. So just moving on to how kind of OneView implements kind of IG. The diagram here shows a high-level overview of data flow into and out of OneView. So initially looking at how data flows into OneView and how it's processed, data is extracted from source systems, it's matched to create single view, and it's pseudonymized. That pseudonymized data is used to both evolve algorithms, but also to generate analysis for specific families and children. So for example, in the case that Hannah outlined in terms of her little road map, that case would have been identified, but it wouldn't necessarily have been surfaced to anybody because there's a whole bunch of controls that wrap around whether that family could be surfaced to anybody. I guess the key point is kind of from beginning to end, what data is extracted and how that data is pseudonymized, what processes it's used in, is all subject to the data sharing protocols, the information governance framework that sits across OneView. So thinking about flow of data out of the system for a minute, this is again controlled by data sharing protocols. And these are typically linked to kind of 5 high-level use cases that we define in the information governance framework for each domain. 3 operational use cases that are shown there in gray, and 2 management use cases that are shown there in orange at a high level. So looking at the operational use cases, the first one there is about reacting to demand. So for example, how should data and insights be used to support smarter, faster decisions by professionals, for example, by the MASH or the front door? So you can see the example that kind of Hannah highlighted in the context of taking a role as an early help manager or as the person reviewing that case. That could equally be sitting at the front door with MASH responding to cases that are coming in for triage. In terms of proactive contact, under what circumstances should we proactively offer support to citizens? And that's kind of, PA alluded to that kind of point earlier on, that particular family, they had to be, the one that we talked about, had to be certain conditions that were met in order for that to be surfaced through a proactive contact. Having said that, COVID seems to have changed and kind of accelerated people's thinking about that, because COVID has been very much about outreach and proactive contact to vulnerable groups. And from a public health perspective, how can we signpost people to services before they reach crisis point? And how can we get people to seek support from the council earlier? So there's those kind of the operational ones. In all of those cases, the data sharing protocols ensure that the data that's shared with the individual it has a legal basis, it's proportionate, it's locked down, and it's based on user roles, and it's logged to ensure that the data that's visible, that's shown, the analysis that's shown, that's visible is appropriate to the purpose that was agreed and set out. I think I've probably run out of time, so I'd just like to basically discuss very briefly how should we measure success of these sorts of systems. So there's an article in The Guardian on Sunday, I don't know if people saw it, around 29% of social workers think their workload is manageable. And so from my perspective, in that context, this is successful by measuring success of it to the extent to which we help professionals do their job, and actually that it's actually less about data and it's more about people. So are professionals able to spend more time with people they serve and less time gathering data and completing forms? Are their interactions with their clients better supported with useful insights in terms of what risks have they faced, what other services are they dealing with? And ultimately, are the consequences of this are that we've reduced harm for those individuals and those families, coming back to that ethical principle at the beginning. I mean, finally, we've run through this very quickly. We are writing a blog, which we'll put up on our website and on LinkedIn, so if anyone wants any more information, but I'll hand back to David at that point to kind of bring us to questions.
Thanks, Wajid, and thanks to PA and Hannah as well. I hope this little window into the work at Barking and Dagenham has offered you some insight into the art of the possible. We've had some great questions coming through while presentations been in progress. Probably the most popular question was, will we be sending copies of the slides out to participants? Happily to say yes, we will be doing that. So we'll be in touch afterwards with all participants with a copy of the slides, and you'll also be able to see, if you want to point colleagues to this webinar, we'll also be posting that up on the website as well. So we've got time for probably 2, 3, 4 questions. So I'll just refer to a couple that have been coming through. If Hannah and PA could join us for this. So Wajid, this may well be one for you actually, and PA as well. So gathering of data across agencies, 2-tier LAs already struggle with this. Does Barking and Dagenham or Xantura have a view on collecting this data for analysis when it's not easily accessed?
Yeah, I could take that one. So we are actually working in a 2-tier scenario at Kent, where we're working with Maidstone District Council. I mean, from our perspective, the way the infrastructure is set up is that what we have is we have pockets of we have data controllers, data owners of data. They sit inside councils, inside services that's inside councils, but also sit outside of those councils. So in terms of partners, the key point is actually, so from our perspective, where the infrastructure is oblivious to where the data is coming from. There has to be an information governance control point that sort of says, this is the data that can be shared, etc. And then we can, from a technical perspective, we can make that work. In terms of the 2-tier situation with, for example, in Kent, the very high value adding activity that we're beginning to facilitate there is actually the flow of, for example, around debt and homelessness, is the flow of vulnerability data into that view at the district level. So the district is aware that someone who's has got a debt issue or is about to become homeless also has is also engaged by children's social care. and equally from children's social care perspective, that they know that there's a debt picture outstanding with the district council. So that join up of data is beginning to demonstrate kind of real potential value, and we are and we're making that work already.
Just to follow up to that, Wajid, we've had another question come through related. Which partners do you typically draw data from?
Yeah, so I mean, we've got some data flowing from police. But the majority of our partners are people like children's centres, commission services, housing associations, those sorts of organisations. In terms of the bigger partners, I guess that questions probably underpinning that is really around the health system and how much health data that we get flowing into the system. There's a couple of points there. There is a lot of, to PA's point around having identified 90% of the shielded list before it arrived, there is an awful lot of health information already in, for example, unstructured case note data in social care systems. So there's something about mining that data more usefully, because you do know more than you think you know within councils if you go across boundaries. More widely, what we're doing is there's a couple of projects that we're doing, which is just about to connect in primary care data, very controlled flows of data of primary care information into the system. And we're also talking to kind of a community provider as well around kind of mental health data. So we're beginning to make inroads into that space. And it comes back to the point of establishing trust through the IG approach, because the more trust we establish through the IG approach, the easier it is to facilitate those flows.
Great, thanks, Wajid. I think this one's probably for you, Hannah. How did you ensure that social care managers were trained to understand the data and how to use it effectively?
Yes, so we spent a lot of time working with managers and individuals within the teams. We had super users, we had lots of working groups in terms of the initial setup and designing. We had a lot of conversations around what the data meant and looking at what experience workers had from directly working with the families, and they helped a lot with the language. They helped us work through the science of safety process so that we could look at what the data was saying around positive factors and resilience factors, as well as risk factors and the kind of complicating grey area factors. And then we spent a bit of time looking at historic cases as well. So we looked at what information they were seeing for cases historically, and then what OneView would have shown them, and then would they have made a different decision if they'd seen the different amounts of information. So we worked right across, and it was a partnership approach, because obviously different data means different things in different organizations. So there was some sort of working groups and some transfer of knowledge, which was really helpful, not only for this process, but generally in terms of communicating better with each other and setting things up as partners.
Thanks, Hannah. Plenty more to choose from here. So question from DFE actually. Can you talk more about the ability of the system to predict demand pressures and how this relates to making cost saving at local authority resources?
Yeah, I'm happy to take that one. I think one of the things that we're doing is basically, in terms of demand prediction, is when we incorporate the data into the OneView platform, essentially what we do is we create a time series out of the data. So we understand for specific families what risks have occurred, when they occurred, what interventions have gone in, when those interventions went in. And what the system's doing is it's basically using that pattern of behavior, that pattern of risks at an aggregate level, and linking that to demand. So we've built prediction models that predict what's the level of CLA demand, children looked after demand, that will appear in quarterly periods moving forward. That's not based on kind of looking at what CLA demand was before, simply and sort of saying we'll apply a rule to kind of uplift that slightly. It's looking at the underlying data. So it's saying, is domestic violence escalating? Because in the data, there's a correlation between DV and CLA cases. Is debt escalating? Because actually there's a correlation between debt and perhaps and CLA cases. And it's looking at all of the risk factors that we've kind of established, and we pull out of all of the data to make those predictions forward. So there's a solid basis for it. The advantage of that is that you can then look at the demand and say, the reasons for that demand are the escalation of these risk factors. And therefore we need to look at the interventions we have that have the potential to address those risk factors. So it's not just simply about demand, it rolls neatly into kind of well, what do we do about that from a commissioning perspective, given that likelihood of demand emerging.
Right. I'll try and a couple up here. Are the dashboards already set up, or is this something we need to do internally? And what view would a business intelligence analyst get?
Okay, I seem to be happy to take all of these. Apologies.
Do chip in if you have anything to add, Hannah or PA.
Yeah. I think the dashboards, there's a version of the dashboards created, which we've evolved very extensively with Barking and Dagenham. There's dashboards available for each of the tiers, EH, NCP, etc. They're not fixed. So actually, as a client, you can update those. We actually, and as PA's team now has access to the data, you can create your own Power BI reports out of that to extend and evolve those charts and reports. So what they are is basically an accelerator, a starter to get you up and running with the analytics in a way that's useful, in the way that Hannah outlined. But what you do with them next, and specific questions that you want to answer. The key point is there's a data asset there that's your data asset, and we allow you to plug into it using your tools to build whatever analysis you want to build out of it.
We did have a question during the presentations actually regarding the ability of OneView to interface with systems other than Liquid Logic. We're getting a couple of other questions coming through now on that. Wajid, would you just like to say a couple of words on that?
Yeah, fundamentally, that was a really important realization for us. We couldn't build something that didn't sit inside the existing case management systems. That was a big barrier to people using the systems we were building. So what we've done is basically, as long as the system is a browser-based system, so you access it through Internet Explorer or whatever, then actually we can put that button on any system. So we can put it on Mosaic, we can put it on Liquid Logic. For one of our clients, with respect to a debt project, we put it on their Oracle financial system, on their revenues benefit systems. So, and that's a very light touch integration. We don't need to talk to those software suppliers to get that integration done. We can just basically deploy that across those. So absolutely, it integrates. It would sit in the way that Hannah kind of outlined when you did the case summary piece. That would sit exactly like that inside Mosaic and other products, for example.
Right. Sorry, Wajid, this is probably another question for you. But in terms of some of the ethical aspects of this, how do you address ethical use of modeled estimates, likelihood of stepping up, likelihood of stepping down, when these will have associated errors and false positives?
Yeah, I think this comes back to, the fundamental point that everybody's made in all of these presentations, I think, is that what we're not doing here, and the way that we surface that data, is that we are not saying do A, do B, do C. We are putting information in front of professionals who would want to, who then need to make a judgment call about those particular cases. So, this isn't, so in terms of, absolutely, we're not going to get it 100% right. And, if you take the education example that was done before, it's the diametrically opposite to that approach, isn't it? What we're not doing is basically sort of saying, you've got a grade A, you're going to have this intervention, you're going to have X, Y, and Z. What we're doing is we're surfacing it within the existing processes that exist within councils to make those professional, high-value analysis and judgments about particular cases. It's not about making those decisions. But we are setting factual cases. We're not going to surface a case if risks haven't escalated, if risks aren't present. And quite often what we're finding, coming back to PA's point, if this isn't a case that you should be doing something about, there's something happening here, maybe somebody else should be doing something about them. So, so that kind of error rates is a complex area to unpick. But from an ethical perspective, it comes back to the point, if we're setting up systems that are about reducing harm, if the consequence of this isn't a punitive action, if the consequence of this is an offer of support, and even that can appear punitive to people, but we need to be aware of that when you're offering support. So how do we address that? Those are the real questions about kind of how do you make early help work? And that's kind of the broader organizational transformation that organizations have to deal with. And we're part of that, and we're adopting that kind of philosophy, really.
Right, thanks, Wajid. So I think at this stage, I'll begin to wrap up, because I appreciate people will have other things to move on to at 11 o'clock. So thanks for your questions very much. We'll circulate a written response to some of the other questions that we haven't managed to get to in coming days. We hope you found this webinar of interest, and if you think Friday's forthcoming session to colleagues in adult services would be of interest, then please do connect to our website, where you'll find details of how to register for that.